There's one nagging condition that affects all of us, takes athletes away from their sports, makes our jobs very difficult to do. Driving a car becomes extremely uncomfortable. And sleeping, forget about it. It depresses us, and sometimes it even lands us on the operating table. You guessed it, lower back pain. Low back pain is not a condition that we can completely cure, but a condition that we all need to learn to manage. On today's show, you will learn about some of the more common causes of lower back pain in youth athletes as well as the general population. You will get to see some of the techniques we use to decrease your pain and increase the strength of the muscles connected to your lower back. You will find out why pain, aching, or numbness and tingling in your legs can actually be a back problem in disguise. And later in the show, you will meet one of my patients who didn't realize how very close he was to never walking again. According to one study, over 50% of children get back pain before the age of 15, and 84% of those children go on to have back pain in adulthood. Well, today we're here with Jeremy Shore, and we're going to be talking about back pain in athletes. How the heck do our athletes get back pain?
Falling, injuring themselves during games.
Yeah, that's right. Trauma is one incidence. One sport that particularly comes to mind when I see female athletes in the clinic is gymnastics. The repetitive overloading of the spine, the repetitive landing and extension of the lumbar spine is the culprit with gymnastics and many other high-impact sports like basketball and even high-velocity rotation found in softball and in baseball. Two of the primary factors that cause low back pain in athletes are muscle imbalances and a deficient core. Now the core, we talk about the core. Many people may think the core is the abdominals. When we talk about strengthening the core, people might think about doing ab work. But actually the core is several muscles that actually cross the lumbar spine, the pelvis, and the hip joints. Okay, so there's actually about 29 muscles that are considered the core. And what we find in these youth athletes is there's muscle imbalances, whether the left hamstring is longer than the right hamstring, or the hip flexors are tight, or the muscles going right up to the lumbar spine, the hip flexors in the front of the pelvis that cross. As you can see, these hip flexors cross the lumbar spine and they run down deep into the pelvis and into the hip joint. Now these hip flexor muscles are often tight on people, and when they land and they run and they go through acceleration movements, deceleration, high impact jumping, if these muscles are tight, they have a severe impact on the mechanics of the lower back. So two of the very common conditions that result from repetitive overuse and trauma, muscle imbalances, and inefficient core strength are spondylolisthesis and spondylolysis. Now a spondylolysis actually takes an athlete right out of the sport because a spondylolysis is a fracture. And it is what we call a defect in the backbones of the spine. Okay? And from that repetitive trauma and uneven loading into the lumbar spine because of muscle imbalances and inefficient core strength, the loading goes to areas that it wouldn't normally go to. And so we have what we call a pars defect in the bone. And this leads to debilitating back pain, and until we remove the repetitive stress that's happening in sport, this condition can continue to worsen. And if these bones break off a little bit, the top vertebra will actually shift forward. And when that shifts forward, it's called a spondylolisthesis. And this can cause many problems for athletes, and they have to be put on very specific exercise programs to target it. So how then do we get these athletes back to sport quickly? Well, the number one thing is removing the repetitive stress that they're going through in their actual sport. Sometimes this leaves athletes quite frustrated because all athletes want to be back on the field. But we have to do the deed. We have to take them out of the sport, the repetitive overloading, and we begin in the clinic with flexibility training to correct imbalances and also a very strict and regimented strength and conditioning program for all the core muscle groups throughout the lumbopelvic hip complex. Let's go now to show you some of the strength and conditioning exercises that we prescribe athletes for their core to get them back to their sport quickly. And coming up next, we're going to talk about disc herniations and how that pain in your legs could actually be a back problem in disguise. And the debilitating condition called spinal stenosis. What is spinal stenosis? What can we do for it? And what can't we do for it? And later in the show, meet one of my patients who was very close to never walking again.